Okay. So I actually spoke with someone that we had worked with who is outliving her best life and just kind of went through the details and again and she wrote this beautiful uh paragraphs as well to share. So we're going to call her Jasmine for confidentiality reasons. Obviously, she's 32-year-old white female with Hispanic origins. Um, she was living in a toxic environment. The baby's father was abusive. There was drug use in the home, and she had overdosed twice. At that point, she had been using fentanyl for 2 years, but she had a prior history of meth, heroin, THC, alcohol, probably more. Um, but fentanyl had been her primary focus because that was she needed that to live, right? So she had been successful on buprenorphine before. And it became the financial burden, the transportation to and from that prevented her from being able to stay in that program. So she was in withdrawals at the time, inducted into the EC, then checked out by labor and delivery, um, so that mom could continue the medication. At either Serenity Village or the Forester Center. She ended up coming to the Forester Center. So she had no transportation, housing, or job. We helped her call other family members to secure temporary housing. She was within at least a month and a half probably before delivering. So when we met her, um, she transitioned Matt to another provider after 8 months of being in treatment. She was um, probably one of the most inspiring patients that I've worked with on both sides. She was just so profound in how she responded to the peer recovery, you know, story, right? Just being able to say, look, I was in recovery. I was pregnant. I'm in recovery. I have my children back. That's not always how it happens, but that is definitely something that is possible, with a lot of different variables in between. Um, it was like hope just ignited her face. It was amazing. Um, she had a lot of setbacks, a lot of problems to work out, and but through that treatment course, we were able to really help her learn the way that trauma had impacted her life, the skills to manage that, and to leave a lot even of her family she wasn't able to really associate with. I know that in domestic violence situations, it is increasingly challenging for moms to get out of that. That in and of itself is even much like the addictive cycle. So, obviously, really proud of her. But there are so many other women who didn't quite have the same story for different reasons. So I really do hope that she will become a peer support specialist one day, when life allows her. So I think what she shared is just, takes it to the next level, I guess. So when I walked into the emergency center, I was at my lowest, pregnant, afraid, and certain that I was about to lose everything. My substance use had already taken so much from me, and now DSS was being called. I thought it was the end, but then a peer support specialist stepped in. She didn't judge me. She didn't look at me like I was a lost cause. Instead, she saw me, the mother I wanted to be, the woman I could become. She fought for me, advocating for me to get into Serenity Village, but when they would not allow me to take my baby there, she didn't give up on me. She walked with me through every step of my journey, helping me navigate treatment at the Forester Center and showing me how to rebuild my life, and reminded me every day that I was worth saving. Through her support, I not only found recovery, I fought DSS and won. Today, I have a safe, secure, and independent housing. I have a job. My child is with me. And for the first time, I feel free. Because of the impact that peer support had on my life, I now hope to become a peer support specialist myself, to be the same lifeline for another mother that was my peer for me.